Heather Loftus broadcasting live from the 44th Annual Health Fair and Expo presented by Baxter Health, the KTLO Classic Hits in the Boot. We are here on the Farmers and Merchants stage, and I'm so excited. We have two legends in the building with us today. Dr. Tom Knox, Dr. Wynn Moore of Baxter Health Bone and Joint. Welcome, gentlemen.
Thank you.
Thank you.
Dr. Knox, I've known you, I think, my entire life. How's orthopedic surgery going in Mountain Home these days?
I think orthopedic surgery is going extremely well. We have several great orthopedic surgeons in town, and our practice is state-of-the-art with the rest of the country.
Dr. Moore, how long have you been in Mountain Home?
17 years.
17 years. How has surgery changed in those 17 years at Baxter Health?
Well, I think a lot has to do with the fact that administration and the board has provided us with better equipment every year. Things we need have not been hard to get, and so that helps us. I've been in hospitals that you couldn't get things that improved your practice. We had no trouble here. So I think the biggest thing is the acquisition of the equipment we need to get the job done.
It feels like, we've seen a lot of different reports that people may not be electing to have as many surgeries this year as they have in years past. Have you guys noticed that in orthopedic surgery?
As a matter of fact, we have, and it's a national trend. Our Smith & Nephew representative, I was talking to him the other day, and this is news that I was going to share with you, Wynn, but they have actually lowered their quota for a 5-state region Smith & Nephew has as far as what the number of implants that they would expect to sell. So it's a national trend right now. It really is.
It's not because we're getting any healthier, that's for sure.
Oh, no.
We're slowly growing in that aspect of joints, getting busier and busier.
What's the primary surgeries that you see in your clinic in this area?
Well, electively, it's joint replacement. That's our big stuff, and sports medicine scopes. Primarily shoulder, knee, that's the big stuff. And then, of course, replacements, mostly on the elective side. Mm-hmm. Now, when you get into the trauma side, it's, sky's the limit. Every bone could be broken, and we can fix every bone. So, yeah.
I'm not sure replacements are elective. I think you kind of have to do it if you're getting it done.
Well, I think that they're necessary. But to me, elective means someone has a chance to think about it. If you come in with a broken hip, you can't think about it. You've got to get it fixed. So we kind of have a captive audience with that. So,
yeah. Of course, speaking of replacement surgery, knee replacement in particular, the hospital earlier this year invested into the CORI robot,
yes,
which is really helping patients and patient outcomes.
It is. We explored the robot about 3 years ago, and through the evolution of the process of how this robot works, it has become better and better. And so about a year and a half ago, we adopted it. All of the orthopedic surgeons is using it. Initially, they thought, we'd maybe use it once or twice, but everybody uses it for every total knee because it is just that important to have accurate placement of your implants. Mm-hmm. And I think it's leading to better outcomes as well.
Mm-hmm. What's the most rewarding part of your job?
Actually, I like taking care of kids. We don't do all the things that deal with children, but I love that part of it. Number one, they heal so fast, mm-hmm. and they get back to doing what they want to do. And then you've got replacements, people that can't walk, mm-hmm. are struggling, and you give them a whole new lease on life. And what Tom's talking about the robot, I think when we first got the robot, I wasn't a big fan of it at all. In fact, I thought, I've been doing this for 25 years. I don't think I need a robot. And I think what it has done, though, is it's made everything reproducible.
It is. Yeah, I agree.
So that you can make a plan and feel pretty assured that at the end of that case you fulfilled that plan instead of the old way of kind of eyeballing it and using your guides. But and I think it took a while for me to really fall in love with it, but it works. It really works.
And it, in all fairness, it adds probably, what do you think, probably 20 minutes to the case, would you think, Wynn?
I think at first it took 20. It's probably 15, 10 now,
15,
depending
yeah,
upon the case.
Yeah, 15, 20 minutes.
If all the numbers work out, it doesn't take any longer.
Yeah.
Dr. Knox, do you have a favorite surgery that you do?
Probably 2 or 3. I enjoy upper extremity surgery a tremendous amount. I started shoulder arthroscopy in this community in 1987, and that's always been a passion of mine in terms of evolving and further increasing the care pattern of what we're doing there, whether it be instability, rotator cuff repair. And then moving on down to the elbow, I enjoy doing elbow arthroscopy, treating tennis elbow, degenerative problems, and hand surgery has always been a keen interest of mine since I came here in 1983.
How many surgeries do you think this guy's done since 1983?
I have no idea. Tens of thousands, because I surpassed 10,000 last year in my time frame here, so he's way in that 20, 30,000 cases, I'm quite sure, or more. You've been here 40, 30-something years?
Let's see here, 42 years.
Probably closer to 50,000 then.
In my early years of practice, that's interesting you asked that. In my early years of practice, I averaged probably 950 cases a year. So I don't do near that many now, but this has been a long history of orthopedics for me in this community.
Yeah. You know, it's amazing to me how orthopedic surgery has changed over the years, especially with the amount of time that you stay in the hospital. You know, if you used to have a knee replacement surgery, you were in there, you did surgery on Friday and you sent them home on Monday, or maybe hip was that way. You get them out of there fast now.
Well, there used to be a time they were in the hospispittal for a week. I mean, that was really...
I remember, typically
like the
people
old
would be in the
gallbladders.
hospital a week after a joint. But no, we aim to try and get people out within 24 hours if possible. The federal government, through Medicare, approved joints for outpatient care, and that's telling you that they would like to move that way as well. It's an efficient way of doing it. We have, at our clinic, we have completely changed our pain management program after having a knee replacement or hip, using what we call multimodal pain pathways to control pain. And it gets people off of narcotics and onto more effective medications for controlling the pain, plus decreasing inflammation, and I feel like enhancing their outcome, both at a week and 30 days post-operatively, particularly for knees in terms of achieving flexion.
I always love to ask this question to physicians, but how do you describe our medical community here in Mountain Home to your peers?
No, it's the best I've ever been involved in. I've been a lot of places, and this is really absolutely the best. It's amazing. This size of town has this kind of medical facility and physicians. I would never have ever dreamed that it could be this good, but it is.
Yeah.
Oh, I agree completely. In fact, the reason what turned the corner for me to come here in '83 was Dr. Fred Turner and Dr. Peter McKercher, who were both living at that time. Peter was a GI fellow at the University of Missouri when I was a medical student, and Dr. Turner was one of my professors of medicine when I was there. I had the highest regard for those gentlemen. They were incredibly intelligent, and I thought, wow, if these guys are practicing here, that says something for what kind of medical community this is. And I've never been disappointed. I feel like the physicians that we have on our staff are nothing but excellent, and conscientiously try and give good care to their patients as well.
As part of Baxter Health Bone and Joint Clinic, you not only have you guys, the physicians, but you also have your team of physical therapists. What role does physical therapy, I have to ask this question, you know that. What role does physical therapy play in the outcomes for an orthopedic surgeon?
Bottom line is a good therapist will make sure that a surgeon looks good. That's the bottom line. It's all about, will the patient rehab, and can your therapist motivate them to do it? I can do the best surgery in the world, and if they don't get the rehab, the results are not good. And here, it's been outstanding. The therapy that the hospital has, and local, other guys all around the city. There are really good therapists that enjoy what they're doing and do, really work hard to get our patients back on the road.
I agree completely. The one thing that we have here with our physical therapists at my clinic here now, we have a constant dialogue of what our goals are for the patients. And we converse regularly on how we're achieving those goals. And it allows for early intervention if something needs to be changed in terms of accentuating a certain aspect of their care. But I've had folks from out of town that have driven down to Mountain Home, say 50 to 60 miles from Mountain Home, to participate in our therapy program here because it is so outstanding compared to what they have locally. And I'm not trying to be condescending towards anybody else. I'm just saying that our folks are really, really good here.
Motion is lotion. That's what the physical therapists always say. They help you because they want to get you up and get moving faster. It's not like it was a decade or so ago. I mean, the faster you can get moving, the faster you're on the road to recovery.
Absolutely. The longer you sit around, the harder it is to get back to your normal daily living. One thing that I think most people don't appreciate about Mountain Home is that we have a huge joint replacement program with all of us doing them. But the thing that's unique here is that the comorbidities that our patients have is very high. Way higher than Little Rock, who has a younger population. So we've engaged the hospitalists to help us on a routine basis to help manage these medical issues that invariably pop up, whether it be a hip fracture or elective joint replacement. And that has helped tremendously in getting patients heading off a problem at the pass before it really creates an issue. So that's been really good. And they've all bought into doing that. And in fact, some of the the sickest of the hips are going to their service to manage them medically, and we're fixing the hip on their service.
I think that's a big advance too. When getting back to the therapy, one thing that we are doing at the clinic that I think has really made a big difference is a so-called prehab. That is, before you go in for an elective knee surgery, I have my patients now visit with our therapist for 2 to 3 visits so that they can get an idea of what's expected of them after surgery in terms of getting their knee motion going. And that ties in with this outpatient joint program where people are going home earlier from the hospital so that as they get home, they are motivated to pursue these exercises because frequently they think, gee, am I supposed to move this knee or I'm hurting? Yeah, we know it hurts.
Yeah.
But yes, you have to move it. That's the whole key of getting well there.
Dr. Tom Knox, Dr. Winmore, Baxter Health, Bone and Joint, thank you guys so much for your time.
Thank you.
Thank you.